Human Metapneumovirus, or HMPV, is a respiratory virus. It's a common cause of respiratory infections. HMPV is a relatively new discovery. It was first identified in 2001. HMPV can affect people of all ages, but it's especially common in young children. HMPV is a single-stranded RNA virus and belongs to the family. This family also includes respiratory syncytial virus, or RSV. HMPV is found worldwide and circulates seasonally, similar to other respiratory viruses. HMPV infections occur more frequently in the winter and spring. The virus spreads through respiratory droplets, which are released when an infected person coughs or sneezes. HMPV can cause a range of respiratory illnesses, from mild cold-like symptoms to severe respiratory distress. In most cases, HMPV causes mild self-limiting infections. However, it can be serious in infants, older adults, and people with weakened immune systems. Human Metapneumovirus, or HMPV, causes a variety of respiratory symptoms. These symptoms are similar to those of other respiratory viruses, like the common cold or the flu. The most common symptom of HMPV is a runny nose. Other frequent symptoms include cough, congestion, and fever. Some people may also experience sore throat, headache, and muscle aches. In infants and young children, HMPV can cause more severe symptoms. These may include bronchiolitis, which is an inflammation of the small airways in the lungs. This can make it difficult for babies to breathe. Other severe symptoms include pneumonia, an infection of the lungs. In rare cases, HMPV can lead to respiratory failure, a life-threatening condition where the lungs are unable to provide enough oxygen to the body. Human Metapneumovirus, or HMPV, spreads through respiratory droplets. These droplets are released into the air when an infected person coughs or sneezes. Transmission occurs when these droplets come into contact with the nose, mouth, or eyes of a healthy person. The virus can also spread through direct contact with contaminated surfaces. This includes touching a surface that has been contaminated with respiratory droplets and then touching your face. HMPV is highly contagious and can spread easily, particularly in crowded settings like schools and daycare centers. The incubation period for HMPV is typically 3 to 6 days. This means that a person can spread the virus before they even develop symptoms. There is currently no vaccine available to prevent HMPV infection. However, practicing good hygiene is essential to reduce the risk of infection. There is no specific treatment for human metapneumovirus, or HMPV. Treatment focuses on managing symptoms and providing supportive care. Most people with HMPV recover fully within a week or two with rest and fluids. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help reduce fever and alleviate aches and pains. Home remedies can help relieve symptoms and support the body's natural healing process. These include getting plenty of rest to help the body fight off the virus, drinking plenty of fluids like water, broth, or electrolyte solutions to prevent dehydration, using a cool mist humidifier to help loosen mucus and relieve congestion, and using saline nasal drops to help clear nasal passages and reduce congestion, especially in infants and young children. In severe cases, hospitalization may be necessary to provide respiratory support, such as oxygen therapy or mechanical ventilation.